There's a lot of fear around financial instability. I aged out of foster care at 17, and so I was never taught how to manage my credit, what a credit score meant, none of that.
We know that about 40% of Americans aren't able to handle an unexpected expense of $400. That's huge. That's just a staggering statistic that shows just how vulnerable our communities are.
I come from poverty, I was a single mom. I had all 3 of my kids by 21. And we stayed at the Tacoma Rescue Mission and did transitional housing. So for me, I do it because I understand the barriers people go through.
We know that financial security is a determinant of health. Some might even say it's a super determinant, given that so many of the upstream factors that impact your ability to have stable housing, buy nutritious food, are impacted by household financial health and wealth.
Kaiser Permanente is the largest integrated not-for-profit health system. And as an organization that truly believes in health, we have to be addressing economic opportunity as an integral part of how we look at health overall.
Just the chronic stress of worrying day to day, living paycheck to paycheck, and how you're going to pay your bills and take care of your family, that has actually been shown to increase your risk of chronic diseases like high blood pressure, heart attack, and stroke.
So I firmly believe that our health is where our wealth is at, right? If we make one wrong decision in our finances, we're looking at years of financial hardship.
Right now in our country, we have about a $60 billion predatory lending industry. And when you have something like that, a condition like that in our communities, people are at risk of going into debt, not understanding credit, not understanding what credit means in their lives.
We don't grow up learning about finances. Don't ask me why we don't, but it's not in the schools. And all of us can benefit from learning how to keep a budget, how to live with the money that we are bringing in.
I think financial coaching will change outcomes for a lot of people. It allows us to understand our finances better, for us to pre-plan our future decisions in life. Car payments, interest rates, savings, home ownership, everything is tied into financials.
As we talk about the wealth gap, I want us to be really careful that we're not blaming it on the communities or individuals. We have to acknowledge that historically in this country, there have been systems in place that inequitably advantage some and disadvantage others, and those things persist. One example is redlining, where you saw certain communities where it was not encouraged to invest in those communities and give home loans, particularly in neighborhoods where we're urban and Black communities. And in those same communities today, we see more liquor stores, more fast foods, lack of fresh produce.
Kaiser Permanente as an institution has a really unique opportunity to be able to leverage national interventions and unique innovative pilots, like embedding financial coaching within social service organizations. And we can't do this alone. We really rely on our partners who are working directly with communities impacted by some of these issues that we're talking about.
If you can integrate financial coaching and education with workforce development, employment services, career track training, your outcomes are going to be much more powerful, because people, not only will they be able to get a job, but they'll be able to manage the finances from that job to be able to be successful in reaching their goals.
One of the clients that I work with, there's so much that she's been through, a lot of trauma. She was in a very, very, very dark place mentally, emotionally. Motivation was zero. Through our work together, through coaching and mentoring her and just saying, hey, you can do this, she's got a job, she's working full time now. And there's something that I'd like to share that she wrote. These are her words. Financial coaching has allowed me to feel better mentally and emotionally. I feel stronger, I feel confident. These things make me feel good. They make me feel like an adult, make me feel like a normal, capable human.
this work. There's so much of it to be done, right? As we grow this partnership, it allows us as well as them to be able to reach into the communities in a way that, has not been seen before.
I don't think that without the coaching I'd be where I am today, because I didn't know where I was going before the coaching program, before Your Money Matters. I really didn't. And it allowed me to develop this path that has got me here. And so I'm very thankful for that.
He came in, he got the help he needed, he got the assistance that he needed, and now here he is 5 years later, full-time business owner, got married, and last summer bought his first house.
I notice the difference when I feel like I have some financial literacy and I have a path and a clear plan. So I'm able to manage my CPTSD a whole lot better. I sleep better. I eat better. I'm able to take care of myself. So it means everything.
My vision for health equity is first understanding that there are many, many things that affect our health. And as healthcare providers, we have to care about those things. We have to ask about those things. We have to meet our patients where they are without judgment. And in addition to providing medical care, we have to connect them to the resources they need to live their healthiest lives.